Wonderful. Okay, so we'll make a gentle start. So welcome everyone. It's great to see so many people here and great to see such demand for this session that we're running. I would again just encourage people to go on mute as they join. And I'm just gonna. Okay, and Anna, if you could help me with that, just so we don't get too much echoing, that'd be fantastic. Thank you. Yeah, on behalf of the Department of Communities and Justice, we warmly welcome you to this training session on the sector support for DCJ providers who, as you're preparing your COVID-19 management plans. Before we get started, I'd like to acknowledge the traditional custodians of the lands that we're meeting across Australia today, pay our respects to elders past, present, emerging, also pay our respects to any Aboriginal and Torres Strait Islander people joining us today, and indeed all Aboriginal and Torres Strait Islander people across Australia. And obviously recognising that this work that we're doing is being particularly felt by those communities, particularly where we know that some of the vaccination rates are quite variable across different population groups. So I'm just going to do a couple of bits of housekeeping, and then I'm going to introduce myself and some of the key people that you're going to be hearing from today. Just confirming that you can all see my screen okay. Thumbs up, yeah, great, okay, good. So just a couple of bits of housekeeping. So we encourage everyone to have your camera on wherever possible through the session. It's great if we can get that feedback. As I mentioned before, if you could stay on mute until there'll be a series of breakout sessions where we'll be looking for people to come off and have good discussions. And yes, it'd be great to have your attention. We have also got for this session a chat group or a chat function. So by all means, just tap any questions that you aren't being resolved in the main session into that function. Now, when we do come up to breakout sessions, we will you'll automatically be assigned to breakout groups for a discussion, and then you'll automatically be brought back into the main session. So no action required. I think when you get assigned, you just have to click OK to accept that you're going to go into a breakout room. But apart from that, the technology should be reasonably straightforward. Hello, and thank you, Kieran, for getting the chat started. So the agenda for today, we're going to do some quick introductions now, then we're going to give a brief overview of the guidance that's been developed to support DCJ providers and what's in it. And then we're going to do essentially 3 sets of interactive breakout sessions where we'll provide a little bit of information about what's in the guidance in terms of some of the risk considerations and controls for workers and clients, for the different operating environments that you're working in, and then we'll have an exercise about how we can bring some of those principles in practice before an opportunity for Q&A at the end. So let me move on to introductions. So I'll just briefly introduce myself. My name is Jay Rebeck. So I run an international healthcare consultancy based in Sydney called Rebeck. We're a team of about 20 who supports government and both health and, in this instance, Department of Communities and Justice to improve outcomes and experiences for the populations that you serve. So we've been working closely with DCJ for several years, and most recently on a number of COVID-19 pieces of work. So I'll just ask a few of the other key people here to introduce themselves. So Sophie, if you could introduce yourself and DCJ, that'd be great.
Hi, Sophie Holloway, Director of Policy and Practice in Partnerships at DCJ. And we're, leading on, all things related to COVID management plans, and have engaged Jay and his team and Justice Connect to help put together this along with support from Peak. So absolutely fantastic that you, so many of you have joined us today. It's really exciting that you're here, and really encourage you to take the opportunity to participate and ask questions. And I know that Jay and Anna and the team will give you the drill about the way this is going to progress, but just very pleased that everyone's here and really looking forward to having a great session. So thanks very much.
Wonderful. Thanks so much, Sophie. And we're very lucky to have Alice and Dan from Justice Connect joining us, who are here to answer questions throughout the session today. So Alice, I might ask you to introduce yourself first.
Thanks, Jay. So, my name's Alice Husband. I'm here with my colleague Daniel Komisarov from Justice Connect. Justice Connect, for anyone who doesn't know about it, is a registered charity and accredited community legal centre. And Dan and I work in the not-for-profit law program, so we provide free legal help to not-for-profit community organisations. And for the past number of months, we've been providing support to the sector in relation to COVID-19 issues, including vaccination in the workplace. So we've been invited to these sessions by DCJ, basically to be on standby to provide answers to legal questions that you might have about implementing your COVID-19 management plans. So I just wanted to, as a lawyer, quickly let you know that today we're providing legal information and not legal advice, which means we can give you general information to point you in the right direction, but won't be able to advise you on the spot in relation to your organisation's specific legal issues. But we will be able to give you some information about how you can actually go about getting legal advice from Justice Connect in a little while. So that's us. Thanks, Jay.
Lovely. Thanks very much, Alice and Dan. It's great to have you with us today. And as Alice mentioned, there is additional support that Justice Connect is able to provide some of the more detailed questions. Great. Okay. So those are the key introductions that we wanted to make. Just noting on this slide, here are some of the other people that are, I think, joining today. So we've got Michelle Dowd, Shay Baxman from the Commissioning Policy. So great to see you guys here. Anthony Shannon, Claire Edmonds from the Early Intervention Division. And from my team, we've also got Mika Kato, Anna Baker, and also Alex Chai as well. So they'll all be contributing to the session today. So we're going to give a little bit. So Alex and I are going to give a little bit of an overview of the guidance, and Alice and Dan are then going to talk us through some of the support available to providers before we go into some initial questions and answers, and then we'll get into some breakout discussions. So in terms of the purpose, context and objectives, so the guidance is, we've been through an extensive consultation and feedback process over the last 2 weeks with all of the peaks and have finalised the guidance, which I understand is going out today. So that's just been happening throughout the course of the day. The purpose of this guidance is to equip DCJ providers who require support with the skills and tools to develop a robust COVID-19 management plan. Now, when we say a COVID-19 management plan, this is an important point to make. This isn't a thing in itself. This isn't a separate document. It's actually the aggregate of 3 documents. So the 3 documents that make up a COVID management plan are a COVID safe plan, which you'll be familiar with through the New South Wales website, a risk assessment, and a business continuity plan. So those are the three documents that make up COVID management plan. And DCJ has previously provided a policy stating that all DCJ providers need to have this COVID management plan, i.e. the 3 things in place by the 22nd of December 2021. So the guidance that's being published today, all it does is provide a bit of additional context and support about how to do that. And the reason that DCJ is doing this is because of having surveyed providers. There was quite a significant number, approaching 400 of the over 800 providers that support DCJ, who actually said that they would appreciate a bit of additional support. So this training session today is being delivered in conjunction with the guidance that's also being published. So the objectives of today are really to explain how the guidance can be used to complete a COVID-19 management plan, apply some of the learnings to the training to some real life examples. So we'll give you opportunities to have some discussions in groups and offer an interactive forum to ask questions and share common experiences. So as I say, feel free through the breakouts and through the chat to take advantage of that. So if I just give a brief overview of the guidance. So first of all, just a couple of points on scope of this guidance. So this guidance does apply to service providers in respect to the services contracted to provide on behalf of DCJ, but doesn't apply to organisations who are only receiving grants from DCJ. So that's just a point of scope. The second is the guidance, it does provide providers with the management plan templates, examples and resources. So we've actually, for example, developed a bit of a template for a risk assessment and given some really clear guidance about how to develop a risk assessment, because we'd heard from the sector that was an area requesting support. But it doesn't require you to complete new plans. So this is a really important point. If you already have robust risk assessments, business continuity plan, COVID safe plan in place, we're not asking you to provide additional guidance. There's no additional. Just to reiterate, this guidance has been provided because we've listened to the sector, and the sector's been saying that you would like to have additional support. So this is that additional support, just to clarify. And then thirdly, the guidance, it does provide some considerations for the common legal questions, and Justice Connect are happy to answer questions during the training. But any specific legal advice that might be quite contextually relevant, as Alice was saying, can be provided on a one-to-one basis after the session. But hopefully we should be able to pick up some of the kind of key issues. So I think that covers off that point. And yeah, just recognising that because of some of those issues are quite complex and contextually relevant, they need to be dealt with on a one-to-one basis. So I'll just talk you through the overall structure of the guidance. So the way the guidance is structured, so as I mentioned previously, we have the overarching management plan. Like I say, it's not a thing. It's just it's the sum of the three parts, which are the COVID-19 safety plan, the risk assessment, and the business continuity plan. So that when we ever use the term COVID-19 management plan, just so everyone's clear that that's what we talk about. Those three, once those three things are in place. Now, the way we structured the guidance and resources are that we've got a chapter against three sets of considerations. So the first is for workers. So workers, whether that's contracted, subcontracted workers, we've provided guidance on that in chapter 3. In chapter 4, we talk about clients and again, what the risks are and what the specific controls are. And then from the operating environment's perspective, so recognising that there's different considerations, whether it's face-to-face, or virtual, whether you're delivering a service on your own premises as a service provider or you're going to somebody else's premise. So there's a range of different considerations for those different operating environments that you'll find yourself delivering. So the guidance really steps through that. So what I'm now going to do is I'm just going to hand over to Justice Connect. So Alice and Dan, if you could just talk us through and provide an overview of the guidance and some of the legal requirements, that would be fantastic.
Yeah, so in the risk assessment process, your organisations probably already have been engaging with a whole number of areas of law, including work health and safety legislation. Some of you might need to be thinking about anti-discrimination law. A big one that organisations have been approaching our service about has been privacy law, especially for employees. We need to think about all the instruments associated to the employment relationship, including the employment contract, a potential modern award, there might be enterprise agreements. So it's really important as you go through your risk assessment that you're considering all the associated legal issues.
Lovely, thank you for that, Daniel. And so I guess that's really helpful just to recognise that a lot of the requirements that are actually placed on service providers actually come from existing legislation that's already out there. And so really, all that DCJ is asking is that giving you a structured framework to making sure that you're able to be compliant with existing legislation. Thank you for that, Daniel. That's really helpful. So I'm going to hand over to Alex next, who is going to just talk us through some of the more detailed aspects of the guidance. So Alex, I'll hand over to you. If you could talk us through this, that'd be great.
Great. Thanks, Jay. So the first thing to expand upon would be the overall structure of the bits that providers are interested in, which is the COVID-19 management plan. And in today's training, we're going to run through the COVID-19 safety plan very briefly, because that's something that's hopefully been established already. We'll spend a bit more time on the risk assessment process. And finally, we'll lightly touch upon the business continuity plan before we head into the breakout. And as just to reiterate, what's been said before, if these plans already exist in your organization, you don't have to complete another template or another plan, and they're considered together as a COVID-19 management plan. The other thing just to highlight as part of the DCJ policy is that there are some processes and activities that should be included within the COVID-19 management plan and documented as either part of your responses to the risk or as part of the business continuity plan. And those are listed there on the right and can also be found in the guidance. And they're things around responding to COVID-19 incidents and supporting clients and workers who are unvaccinated, thinking about recording visitors to the workplace and different sort of COVID-19 controls around there. And it's likely that many of you will already have these processes and activities documented in place. And it's just about formalizing that with DCJ.
Lovely, thanks, Alex. I just wanted to interrupt briefly just to mention that the guidance is now live. And so Anna's very helpfully just put a link to the guidance in the chat. So if you wanted to have a browse through, you can have a look at that guidance through this session. Back to you, Alex.
Yeah, and feel free to put any questions in the chat as we go along. Okay, next slide, please. So just to briefly touch upon this point, the COVID-19 safety plan, hopefully many of you will have this already, and you do not have to complete another one if you do. If you don't have one already, you can visit the New South Wales government website, and there'll be a link in the guidance itself to access some plans and templates available there, and there will be industry specific to the type of services you perform. And you can complete the safety plan and access any resources available from the New South Wales government there. So yeah, okay. So the next bit we're going to go through is just briefly run through the theory and the process for completing the risk assessment, and then we'll show you how our risk assessment template what the considerations are for there. It's important to highlight that a risk assessment should be completed for each service setting or place of work. So this means, if you operate in multiple different locations, you should have a line item or a risk assessment completed for each location, and there should be a plan or a recognition of the risks involved in each location and the responses there. And again, if you have this already in place, you can use this or adapt this, making sure that some of the considerations we list in the guidance are made. So the first step that we're going to look at is identify hazards. And here, yeah, okay, yep, you can go to the next slide.
Thanks.
Yeah. So the first step is to identify the hazards in place. And this is something, you already know quite well and much better than we do in terms of the hazards that are on the ground, that your workers, your staff, your contractors, your volunteers and students are facing, the risks that your clients are facing in the course of the activities that they're receiving. So this may range from accommodation to one-on-one counselling to outreach visits, and thinking about how these activities are performed, whether it's face-to-face or if it's done remotely, or if it's or if you're providing accommodation, and thinking about those three components in a holistic manner. We've listed some key questions here, and there's more in the guidance in terms of how you can think about the risks involved with COVID-19 transmission for your workplace. So this might be thinking about the work environment, thinking about the interactions between different workers, the interactions between workers and clients, how the work is actually performed, and thinking about particularly, what's quite important is to make sure that your workers have been consulted in this. And as Dan was saying before, This is part of the WHS requirements to understand if there are any existing work health and safety problems relating to COVID-19. But the other consideration to make is, are there other people or other organizations involved? There may be contractors coming on site. There may be other organizations or service providers on your premises. So those are some of the key questions to consider. Next, please. The next part of the cycle is the risk assessment itself. And so when you're thinking about this, it's good to have an idea of what the mechanism of potential harm might be. And so, for example, this might be workers interacting with unvaccinated clients who might be more susceptible to COVID-19 infection, and workers may inadvertently be exposed to COVID-19 through minimal PPE or just by inability to physically distance. Thinking about that mechanism, you then have to think about what the likelihood is and severity is. So thinking about what the severity of COVID-19 infection might be for different types of stakeholders. So you could think about the severity for your unvaccinated clients or the severity for your unvaccinated workers versus vaccinated workers. And you can assign a rating to that. You can also think about what the likelihood of such things occurring would be. And so if you have existing controls in place where you have plastic barriers or you've trained your workers in PPE usage, what the likelihood of COVID-19 transmission and COVID-19 incidents might be. And there's a helpful matrix on the actual guidance and the Excel template, which will then enable you to score the overall risk and the urgency with which you should act. And then that will tell you critical, high, medium, low, and the ideal time frame in which you should act upon these risks. Okay, next slide, please. The third component is thinking about how you're going to control the risks. So once you've rated them, you can then think about, and this is a concept known as the hierarchy of controls. And we've just provided an overview here, and there's a bit more detail in the guidance. When you're looking at the controls that should be implemented, you can think about the trade-off between the health and safety protection, the reliability versus what's deemed as reasonably practicable. And so keeping in mind the likelihood and the severity of the risk, it's always useful to start at the top of the hierarchy of controls and thinking about eliminating the risk. So this might be removing the hazards by converting from face-to-face to remote service provision. But it's important to recognize, and this is something I'm sure that all of you have experienced during COVID-19, is that sometimes that's simply not possible. These are people who are receiving essential services, and that can't necessarily always be converted. So you might have to think about alternative controls, which include substituting the hazards, so switching from shared to single room accommodation, thinking about isolation, thinking about engineering processes. And particularly, it's important to consider vaccination, and that's something that we've highlighted in the guidance as a control. Other controls to consider would be administrative, and one of the processes that are required is the QR code check-in to think about. And finally, making sure that your workers and your clients have access to appropriate PPE. Next slide, please. And lastly, once you've decided on what controls to implement, the final part of the risk management cycle is to make sure that these controls have been implemented successfully and that they are maintained. And so we would recommend a review according to a schedule. So generally every 6 to 12 months, but it might be more frequently if we have a new sort of lockdown or a new outbreak, or if there's any new legislation. It's important to note if you do have any, COVID-19 incidents, unfortunately, then to consider whether or not you need to have additional controls, whether the risk is controlled, and where there are significant changes in the workplace, or if your workers say that they're not feeling safe or that they want additional controls in place, that's also a time to review. And so those are some of the components of what to review, thinking about the accountability, the actual PPE itself, thinking about training and the latest information and public health advice, as well as worker input. Great. Okay. This is just a slide that we've taken from the guidance, and apologies if it's a little bit busy, but this represents the steps that we'll take to complete the risk assessment using the template. So we have an Excel template that will be linked on the DCJ website. And when you're going through this, we've color-coded it according to the cycle. So we think about your workplace setting, where it's being delivered. In identifying your hazards, you're thinking about your activities, your workers, your operating environments, and your clients. We think about how each of those components might increase the risk of COVID-19 incidents. And so you're identifying the first 3 steps are to identify the hazards. The next step is to consider what the actual risk is going to be. And that's what we talked about before in terms of assessing the likelihood and severity of a COVID-19 incident and assigning an overall rating. The next step, as we talked about, was controlling the risks. And so thinking about, for those operating environments, workers, clients, what sort of controls can be used. And this is really important because it's, again, a trade-off between what's, the ideal scenario versus, what's happening in the real world. And you also need to think about what are the potential impacts of the controls on your workers and clients you work with. So you might be thinking about issues of staff retention, or thinking about whether or not you might turn away some clients, or how that might impact the clients if they're required to de-anonymize themselves when they check in, for example. And finally, after you've agreed your actions, it's then important, as we mentioned, to make sure that your controls are effective, and if there is anything more that you need to do, to understand what that is. All right. Next slide. And just to briefly provide an overview of the business continuity plan. And this, again, is stuff that all of you as providers have done in one form or another during the pandemic. You have continued to provide services during incredible hardship. And so this is really just attempting to formalize this plan. And so we haven't provided a template in the guidance itself, because a business continuity plan is quite comprehensive, what we found, and it encompasses lots of different components. But specifically, if you have a business continuity plan in place, it just needs to make sure that you make COVID-19 specific considerations. And this might include the risk of loss of staff, or rostering issues, or staff retention, thinking about different dependencies within different subcontractors and contractors and other services if one is impacted by COVID-19. And this really feeds upon the risks and controls you've identified in your risk assessment. And then it's really thinking about what are the actual processes and activities that we've talked about earlier, and how that will feed through into ensuring that your organization can continue to provide services. All right. Next slide, please. And the peak bodies also have a lot of resources available for providers, and we've provided a whole list of them in the guidance. We won't belabor that point here. Next slide, please. Yeah, I'll pass.
Great. Yeah, thank you for that, Alex. That was a fantastic overview of the guidance. Really appreciate that. I'm going to hand over to Alice. So it'd be great if you could just talk through some of the support available to providers, Alice and Dan.
Yeah, thanks, Jay. We thought we'd just mention here that as you move through your organisation's risk assessment, you're likely to interact with a whole range of legal questions associated to privacy, or could we require volunteers to be vaccinated, or what information do we need to collect? So our organisation can deliver direct advice to community organisations. Of course, we have eligibility criteria attached to our advice service, prioritising small to medium-sized community organisations who service disadvantaged communities and who can't access their own legal advice. So Alice will post a link to our advice and page if you do seek your own one-on-one legal advice as you go through this. Thanks, Jay.
Wonderful. Thank you for that, Dan, Alice. That's great. Okay, so we just want to pause at this point and just see, and feel free to use either the chat function or to come off mute if there are just any questions at this point. After this, we're going to go into a few breakout chats, so everyone get an opportunity to ask their questions there. But are there any other key questions at this stage from the group? So let's pause.
I have a question regarding if we've already presented a previous risk management plan and COVID safety plan, and we're not doing direct client service, so it's literally not changed too much. Do we still have to present that? This is probably more one for DCJ to answer if there is no alteration to that, although we haven't introduced mandatory vaccination policy.
Absolutely. So, yeah, Sophie, I'll ask you to follow that one.
Thanks, Jay. Thanks for that question. Good question. First of all, you don't actually have to submit anything to us. We just want you to have completed one, and then in January we will be just checking and saying, have you completed it? And the second thing is, if you have something in place, as you've indicated, no, you don't. If it's there, you just need to say, check it again in the current context, which we all do as part of our risk assessments, business continuity, et cetera, because they're live documents. Check it, and then basically, if you've completed and you feel comfortable as an organisation that you have completed what you need to do to assess risks, develop a business continuity, and that you could manage your business in the context of COVID, then I think that is absolutely fine, and it means that you've completed the work. I think that's about it.
Wonderful. Thanks, Sophie. Yeah, that's a very solid answer, I think. That's great. So any other questions at this stage?
Yes, I've got a question. My name is Tyrene and I'm from the Parks Community Network. I just would like to know, will you be asking organisations if they have mandated a mandated vaccination policy as part of the plan?
And Sophie, one for you.
Yeah, I figured I'd answer this one as well. No. We just want to know that you have a policy, that you have completed your risk assessments, you've worked out the controls that work for your organisation, and that you have those clearly documented. And of course, in doing all of those sorts of things, including if an organisation decided to go down the path of vaccination as a policy, that you've followed the right consultation processes under work health and safety laws, etc. But certainly Justice Connect can probably provide more advice there. So no, we just I guess want to know that those have been completed and that you have your controls in place, whatever they may be. I mean, of course, if you're talking to your contract manager and you want to tell us about that, that's fine. But we're not going to be asking to look at it or specifically asking about that information.
Thank you.
Lovely. Thanks for the question, Tara, and thanks, Sophie. And Sophie, just Jan Schatz has just asked another question. So the initial email said the COVID-19 management plan is due the 8th of December. Now it says the 22nd of December. So perhaps if you could just confirm that date has been adjusted.
100%. We got lots of feedback from yourselves and from Peaks, and thought, no, quite reasonable, extend the period of time. So you have until the 22nd of December. So from today, it's about a month. And look, we'll be sending either information via the contracting portal for those of you who use comms, or via email, just to confirm that you've completed the plans, the risk assessments and plans, and we'll be doing that in early January.
Lovely. Thank you for that, Sophie. Oh, that seems to be all
sorry, I'd like to ask a question.
Thanks, Matthew. Please do.
Hi, Matthew from Parks Community Network. I was just thinking about if we have a mandatory vaccination policy from the staff's perspective, if it's mandated that staff be vaccinated and staff become ill, either getting the vaccinations or we haven't even talked about the booster yet, whether that's going to be part of it. If they get ill or there's an infection within your organisation, whether it be from another worker or a client, does that come under workers' compensation because it's mandatory?
So I'm going to ask Daniel and Alice if you can answer this one.
Thanks for the question. And if the situation arose that a worker became ill because of the vaccine shot, we would encourage the organisation specifically to seek legal advice. But it's also a question that we've answered in one of our FAQs on our website that Alice might drop the link to. Ordinarily, we know that most people don't get seriously ill. Workers' compensation is only likely to apply where there's serious illness attached to the vaccination. And that's when workers' compensation insurance may be enlivened. There's also a federal compensation scheme that may be triggered. So I would encourage groups to have a look at the FAQ on our website if they'd like to understand more a little bit around the risks associated to vaccine-related injury.
Thank you. And I guess the second part of that question, are boosters going to be included in the mandatory vaccinations?
I'm happy to take that one too. So at the moment, we know that there's lots of conversation around boosters and we know how fast moving this space is. The idea of being fully vaccinated now is 2 shots. Who knows, in 6 months' time, it might be 3 shots. So whether an organisation requires those interacting with its service to have sort of a booster shot, the question comes back to, is that a reasonably practicable control measure? We talk about it from a work health and safety perspective. At the moment, where booster shots aren't sort of widely available to the public, we'd assume not, but that's how we're encouraging groups to think about things like booster shots and rapid antigen testing, for example. Is it, a reasonably practicable measure to introduce at this time? I hope that answers your question, Matthew.
Thank you, Daniel. Yes, you have. I appreciate it.
Thanks.
Thank you for that, Matthew. Great. Any other questions at this stage? Okay. All right. Well, thank you for that. It's been really, really important, useful set of questions that have just come up. So we're just going to briefly touch on, we're going to summarise some of the more detailed guidance that's in the guidance that's been sent out in links here. And we're going to talk about some of the considerations and controls for workers. So in the guidance, we go through a bit of detail, as I said, but the key groups we're looking at are staff, whether that's employees or indeed subcontractors, we're talking about students and volunteers and clients. Some of the key risk factors to be considered are the nature and the type of activities in each workplace, vaccination status, and obviously whether or not people are vaccinated and the different risks that emerge from that, some of the vulnerable populations. And we also talked about in the guidance, some of the other factors for Aboriginal Torres Strait Islander communities, for culturally, linguistically diverse communities. The extent of community transmission is clearly a significant risk. So that if community transmission significantly increases, clearly that's going to open up more risk. The means of travel and whether staff have, or indeed students, volunteers or clients have multiple locations. So if staff have multiple employment locations, obviously that increases risk. And some of the key considerations that we've discussed are around obviously vaccination. So vaccination is one of the key controls, and clearly the more people that are vaccinated, the better. Clear communication, and we've given guidance about what sort of good messaging around vaccines can look like. Some of the processes for managing a confirmed or suspected case. And we've actually given a series of flow diagrams and process charts in the guidance that speak to the steps you should consider if you have a confirmed or suspected case. And we talked about some of the worker-specific issues around communication training, some of the rostering considerations, how to protect. So if you've got vulnerable workers, potentially immunocompromised, for example, and broader well-being. And then some of the client-specific controls, such as intake forms may need to be updated, sharing relevant health information from trusted sources. And in the early intervention space, we have specifically, drawn out some of the client groups that we recognise that you work with. This is not an exhaustive list, but it is a list of some of the key client groups. So you can see that there is quite a range. It ranges from First Nations people, homeless people, disabilities, older people experiencing issues with mental health, alcohol, other drugs, and there's others there that I've not mentioned.
President speaking.
And some of the key considerations around those controls. So again, some of the key points here around whether people are living in a remote area, some of the antipathy or hesitation toward vaccination that we see. We're doing a parallel piece of work with the Aboriginal Community Housing Industry Association, and we know that there's lower vaccination rates in some of those communities. And previous trauma, negative public sentiment, household membership. So we go into those details in quite a bit more detail in the guidance. But what we thought would be most helpful for this session now, and we're about to go to a breakout group, is really just put a question for you all to consider, and then we'll come back and have a discussion about this. So we thought, if you think about your service, the service that you're delivering or that your colleagues are delivering, thinking specifically about the workers and clients that you have in your service, we thought it would be helpful to think through what are the top 3 risks for the workers and clients in your service, and which controls do you think would be most effective. And as I said, the guidance you can actually now access, so you can refer to that during this, but also slide 25, we've just presented. So please put any questions that come through the discussions into the breakout group, and then when we come back to have a discussion as a group, we can try and respond to some of those. So Anna's going to work her magic. You'll find yourself automatically put into a group for 10 minutes, and then you'll all automatically be pulled back again. So I look forward to seeing some of you in a moment, and we'll have more discussion when we come back in 10 minutes. Go for it, Anna.
Nice to see you worked your way back, Alison. Dan, I tried to make it so you could boot, so that's good to see.
Oh. Hello. Hello. Hello.
I think everyone's just streaming back in from breakout rooms at the
okay,
moment.
right. I'll block us again then.
Okay.
Hello, welcome back, everyone. I'll just ask everyone to go on mute again so we don't get the background. Lovely, thank you for that. That's really good. So I certainly had we had a very interesting conversation about some of the key risks and controls in our group. And I think there was a few interesting points of clarification that I thought it was worth us kind of talking through. So feel free to put any questions or good ideas that came out in the chat group. But certainly one of the things that there was a question on our group about whether a service was required to refuse people who are unvaccinated and whether vaccination certificates were required. Now, my understanding from developing this guidance is that is not a requirement but I'll just seek Justice Connect just to provide the legal response to that in terms of, is there a requirement for facilities to be, only accepting people into their service if they can show they're doubly vaccinated?
Thanks, Jay. Well, I won't speak to the requirements of the policy, but certainly we have been receiving a number of questions from not-for-profits about whether they're legally able to refuse services to unvaccinated clients. And unfortunately, the answer isn't straightforward. It depends on a lot of different factors. I suppose the starting point is that an organisation does generally have the right to refuse entry to people onto their premises. But really, whether you want to do that is another question. So when you make that decision about whether refusing unvaccinated people is something you want to do, you need to be thinking first about work health and safety laws. So is this a reasonably practicable control measure to address the risk of COVID-19 transmission in the workplace? You also need to be thinking, whenever you impose a blanket rule, such as refusing services to people, you need to be thinking, how might this affect people with a disability or people who might have another protection under anti-discrimination legislation? And of course, another big consideration is your obligations to your funder. Is there something in your funding agreement that prevents you from actually excluding people from your service? Of course, as not-for-profits, you also have to think about your reputation, as well as your overall purpose as an organisation, including if your purpose is to assist vulnerable people in the community, is it really consistent with that purpose to exclude people who are unvaccinated? If organisations are finding themselves in this position and not knowing which way to turn, I'd suggest that they come to us for some tailored legal advice.
Lovely, thank you very much for that, Alice. And I might just reach out to some of the other DCJ people who are involved in conversations. Are there any other questions that came up in your groups that you'd like to put to any of the panel? And indeed, if anyone has got any questions that came up through that discussion, then now would be a good time to talk about that.
I think one of the issues at the moment isn't just about the top three issues, it's about the actually HR implications that most managers are dealing with at the moment. So they're dealing with their direct service delivery clients, they're dealing with, there's a lot of tension at the moment, and staff have walked away and are walking away from the sector a lot, which, that's always an investment in a person. and that by them actually walking away, you've lost all that goodwill and training that you've done. But the whole issue of HR leadership, stress as a manager, stress on the employees, you know, it's quite a major thing. So I think the issues around some of the more easier direct client service delivery and finding out the privacy and all those other things it can be worked quite easily, but there's a lot of intensive energy being used in the whole employee relations sphere at the moment in the sector.
Yeah, and I think I completely agree with you that it's incredibly challenging, and I think that's just a feature of the environment that we're in. I mean, I guess, Sophie, do you have any additional things to add to that? Just recognising it is a very challenging environment.
Look, I recognise that it is an incredibly challenging environment, and I notice also, Kieran from Glebe Youth Service, you've noticed that you know, there's the risk of worker burnout, and you're continuing to do your service delivery, and it's been a long year for everyone, a long couple of years. I think everyone recognises that. I think in the breakout session that I was in, part of my reflection is in fact, many of you have been doing risk assessments and business continuity plans and effectively COVID management across the entire 2-year period. What's changed now is certainly we're moving back to a road to recovery, or opening up, or whatever we call it at the time, and we have vaccination as one of the controls now too. So things have changed a bit. I think my message would be less is more, and you possibly have things in place that you've already been doing and already been using that you can then relook at and leverage, rather than create a huge whiz-bang set of risk assessments and COVID management plans. I'll flip that with, I also heard from in our breakout room from the people there that there's some concern that that's a lot to do also where there's multiple outlets, multiple services. I recognise the time of year. So I guess what I would encourage you to do is reflect on what you can do and keep in contact with your contract manager and with us. We've got our partnership support email, and all of us, actually including me, have access to that. And let us know how you're going, and we'll, you know, we can look at how you're going as on a case-by-case basis towards the end of the year. The intent is not to certainly detract from service provision, but it's about making everyone safe as well, and being able to feel that there's processes in place. But certainly it's good to hear this feedback and reach out to us. We do want to try and get everything done by the time frame, but also happy to sort of have different conversations with contract managers, etc. And just wanted to reflect back on some of the things here that I know that there's been increased demand when services close, and that there's also differing situations across New South Wales at the moment, and that it's an ever-changing landscape. And yeah, certainly want to recognise and acknowledge all that work, and that you know, life and service provision continues. So yeah, certainly keep an active conversation with us, as I think the best that we can say, so that we can then monitor it and adjust as we need in terms of timeframes. Yeah.
Thank you for that, Sophie. That's really helpful. And there's one specific question that's come through, and this is probably a Justice Connect question. As a worker has asked if redundancy is payable if vaccination is made compulsory because they're firm on not being vaccinated. So appreciate any thoughts or insights on that from Justice Connect.
Thanks, Jay, and thanks, Leanne. I can give sort of some general information about what redundancy is. So a person's job becomes redundant if your organisation no longer requires that job to be performed by anyone. So I suppose the question is, has the requirement to be vaccinated changed the job in such a way that the original job that the worker was employed to do no longer exists? So if that definition isn't met, then instead of looking at redundancy, perhaps you might be looking at disciplinary options such as termination of employment. And I would specifically recommend the resources on the Fair Work Ombudsman website. They've got some great resources about disciplining employees who are refusing to be vaccinated, and also really good information about questions like, well, when can you stand someone down, or when can you suspend someone with or without pay? So I'll pop a link in the chat to those Ombudsman resources because they're really good.
Yeah, absolutely. Thank you for that, Alice. That's great. And I was just also seeing and thank you, Daniel, for putting that link in the chat group as well. And recognising some of the other comments coming through, that there's a volume of incoming information that's challenging more so than creating a plan. And everyone, and Kieran, we see on that, everyone is definitely trying to do their best. I think it is important to note that, this is really important to note, and just said this before, that we're not providing, there's no additional requirements as a result of this guidance. If you've got your plans in place, you've got risk assessments in place, then you don't need to do anything new. This was really the purpose of putting this out was in response to the many service providers that said that they were just struggling with where to start, particularly their risk assessments. So this guidance is supposed to be supportive to kind of help provide a bit more guidance. But it's not trying to create more burden. Just got a question, would it be enough to just update an already existing plan that we've based on the suggestions that DCJ provides us if we don't use the DCJ one? And from my understanding, I'll make sure we get it here from Sophie, but from the source of the truth.
Yeah, look, I was in the midst of trying to type a response to you, Yomna, so sorry about that. I wasn't quick enough. But the short answer is yes, it is okay to update, because I think that, as I sort of mentioned, we've been doing this for a while, and many of us have already been working on risk assessments, managing your risks, managing COVID, working how do we adjust service delivery, how do we do it. If you have something already, have a look at it in the context of the current situation, see that it's still reflective, and that's something we would do all the time. And that is absolutely fine. We're not asking you to do a new template, a new plan. We just want to make sure that everyone's had the opportunity to do it, and that there is some sort of plan in place that addresses risks and make sure that service can continue. Yeah.
Could I also ask, sorry, is it possible, sorry, I had to unmute myself. I thought it would be easier to unmute. Is it okay to, the risk assessment itself, so we've got a full risk management plan and everything, as well as the business continuity plan. Would it be enough to just focus on, what's in the risk management plan, or does the risk assessment have to be additional to all of that? Sorry. Yeah.
I think the short answer there is that if you're doing risk assessments based at that, it inform whatever plan you have to manage those risks and continue service delivery, then that's okay. And if there's no particular template, I think, as Jay said, it's as long as an organisation you feel that you have done the assessments to make sure that you've documented how you can apply controls to manage risks to your staff, your clients, et cetera, within your services, then that's okay.
And just to add a few points to Sophie's comment, in terms of thinking about the risk management cycle, I would imagine that you've assessed your risks and you've identified your risks as part of your risk management plan. And so thinking about your COVID-19 management plan, it's more of a process and continuum. So if you've made the considerations that will be listed in the guidance, I think DCJ and Sophie would say that would be more than sufficient.
Lovely. Thanks, Sophie. Thanks, Alex. And thanks for that great question, Yomna. Great. Okay, so I think we've got about 25 minutes left, and we're going to move to one more breakout discussion. So everyone's got an opportunity to I think through the discussions, I think it teases out a lot of questions. Esther, I can see you've got another question, and we will answer that, but we'll answer that when we come back from the next breakout session. So we've got an opportunity to get some more questions. So
Jay, it's connected to a thread above as well.
Oh, sorry.
No, it's adding on to something someone else raised.
So it is. Thank you. I just read it now. Yeah, the job might be. Yeah, thank you for that point, Esther. Yeah, thank you. Yeah, I can now see that. Lovely, thanks for that, Esther. Okay, great. So Anna, if you could work your magic again. So we're just going to go into another breakout group, and I'll just show you, before we do, just a couple of points to note. So really the discussion we want to just get people thinking about is about different operating environments. So obviously, whether we're working in a face-to-face environment where we're actually in the service provider's premises, so you've got potentially a bit more control over the environment if it's yours, as opposed to a face-to-face in external premises where potentially you don't have that level of control. You might be delivering a service remotely, potentially by Zoom or some other mechanism, or residential accommodation, or even shared spaces. Some of the key controls I think consider are clearly the hygiene and cleaning practices, physical distancing, and ensure you've got good records of everyone who enters the facility. We also had a question that came up on our group, which will so there's a few questions that we'll, if we can't answer, we'll take away. One of them is where to get advice on filters, because there was somebody in our group, Kim, who has an office that's enclosed, no ventilation, and it's just air conditioning. So they were just asking about some advice on filters. So we'll take that question away. But those are some of the controls to consider. So again, it's a similar question to last time. So the only reason we say top three is just to get you to kind of as a mechanism to focus on the most important issues. But I guess what are the key risks in the range of operating environments which you're operating in, and what are the key controls that you've put in place? So I think again, we'll just break to, again, it'll be a randomly allocated set of group discussions that we're about to go into, and let's just talk about what some of those key risks are and what some of the key controls might be, and then we'll come back. And when we come back, that will give us an opportunity to then have a final a question and answer session for anything that comes out of this discussion. Okay, so Okay, so welcome back everyone. So we've just got 10 minutes left of the session, and I thought in light of time, I thought it would be good to get some feedback from the groups and any other questions that have emerged out of those discussions. And I think this will also bring us into a bit of a final question and answer session of anything that's come out of those through the discussions. So I might, I'm just going to randomly pick on a few people. So if I can see, Michelle, are you, I'm just checking it. Could you,
yeah.
You're here, Michelle, lovely. So yeah, perhaps if you could feedback any of the comments in your discussion. And
we had a few different kind of operating environments that were talked about. One of the tricky ones was where you had home visits. So support workers doing home visits across really large regional areas. And in that case, and in LGAs where there's been quite high numbers of COVID cases. So the risk controls that this service has been using has been basically to do a lot of the visits outside and in parks rather than going into homes, and also to do over the phone where that's possible. At times where the numbers have been really high, they have just not in one particular area. They've been monitoring the numbers and then delivering alternatives for a particular service around a play group. So they've been, instead of actually running the face-to-face play group when the numbers have been high, they've been dropping off care packages for their families so that they continue with their play to learn approach. So I thought that was some really good alternative ways of dealing with situations where there's high risk and high prevalence. There were many, it was a great discussion, there were many more, but that's just highlighting a couple there for you, Jay.
Lovely, thank you for that, Michelle. And I might ask, Alice and Dan, for any of the conversations you're involved with, if you could feedback some of the
Alice and I didn't join breakout rooms, but I think Michelle's group's discussion is a really interesting one, being that work health and safety obligations adopts a really expansive view of the workplace. And unfortunately, that means for your services that operate in a number of contexts, we do need to adopt an equally expansive view of all the risks. So I think that's a really good point and one to think about.
Lovely, thanks for that, Dan. And yes.
Can I make a comment?
Please do, Tyrone.
One of the things that I've been thinking about a lot in my organisation is that some of the measures and some of the alternative arrangements that were made during lockdown, that we need to really reflect that they were maintaining, they were not best practice or in the best interest sometimes of our clientele. So I think now that we're out of lockdown, there's an expectation we can't continue to provide everything remotely because obviously it doesn't suit some of our clients. So I think we need to really strike the right balance. It's very important so we don't just say, okay, we're going to do everything outside in the park, or when we do home visits, we're going to be talking in the front yard where you have neighbours potentially walking up and down. So these are the things that are really challenging at the moment.
Yeah, understood. Thank you for sharing that, Tyrone. Great. And Mika, could you potentially share, or Alex, could you potentially share some insights from your group?
Yeah,
or any questions?
Happy to, for sure.
Thanks, Mika.
So one of the things that was raised was working in a shared environment. So maybe with other service providers who are not part of your organisation. And the fact that maybe you're not aware of what their practices are, what their policies are, you don't know, what type of people they work with as well. So one of the people in our chat, sorry, I've forgotten your name, said that they were going to go and actually discuss that with that organisation who was in those shared premises, just to sort of find out those things, so maybe they can adjust their own controls appropriately based on what they have to say. So I think that was quite good to sort of have that kind of communication. Another thing was providing extra cleaning items, for example, disinfectant spray. So just treating every time you use a shared space like a toilet or a kitchen, just give it a spray down yourself so that you feel more comfortable in using it and it's safe for everybody. So those were a couple of the controls that were put in place.
Lovely. Thank you for that. And then one of the issues that came out, I might ask Alice and Dan to respond to this, was some of the issues that came out of my group were about they got a situation where, and this happened actually, I heard this a couple of times, where all staff are vaccinated, but but not all volunteers were vaccinated, and that was creating a number of issues, both for the for in terms of it's putting extra stress on those people that are there, but also the mental health and well-being considerations for the volunteers who are often, that's a lot of their social interaction they're getting from doing that volunteering. And then another example came out where there was concerns where some people who were vaccinated, who, for example, their children, they're saying we don't want our children to be in the same facility as unvaccinated children. So I guess, if Alice and Dan had any reflections on any of the legal environment that sits around that. I know it's quite challenging kind of operational stuff.
Yeah, in 4 minutes, there's a lot of issues there. Touching on volunteers quickly, we do have resources on our website specifically about mandatory vaccination for volunteers. The starting point is that volunteers can be subject to a public health order. So that's your first assessment. If they aren't subject to a public health order, then it's a work health and safety assessment. Should we require our volunteers to be vaccinated? Is it a reasonably practicable control measure for volunteers who refuse to be vaccinated, where the organisation has said, yes, we need to require all our volunteers to be vaccinated? That's when we go through the process of potentially ending the volunteer arrangement if they refuse to comply with the requirements of volunteering. Service users involving children is a whole, separate issue. Of course, where some of your services are providing, service directly to people under 12 who can't be vaccinated. Of course, we can't introduce a vaccination policy that says all our service users need to be vaccinated because they can't be. So how we manage those requests from service users will differ case to case, and it would also depend on whether someone is making that request where the child is particularly sensitive or vulnerable because of a medical condition, and we might have anti-discrimination obligations to make those adjustments. We also need to think about privacy law. We can't disclose the vaccination status of other service users. So there's a lot to unpack. In short, definitely seek advice if necessary.
Lovely, thank you for that, Daniel. And I think that really probably brings us to the end of the session today. And I think we found it really, really helpful. Thank you for the messages. A number of people having to dash off to other Zoom meetings. And so we'd just like to say thank you very much, everyone, for contributing to this. There's been a lot of information today. Obviously, lots of links through the chat. The guidance has been published on the website. The guidance itself has got a huge number of embedded links within it. It's all hyperlinkable within there. So hopefully we'll find that a really useful resource. Everything that Dan and Alice have talked about from Justice Connect, there's links from that in the guidance. Again, it's on the Justice Connect website. There's some really rich information in there that we'd point you towards. Thank you everyone for your contribution, for sharing. I hope you found the discussions useful. I certainly have. And huge thank you to Justice Connect, to everyone on the DCJ team who's been involved with this, to my team, to the Peaks who've consulted with us. And Sophie, I might just leave it with you, just if you wanted to say any final words by way of sort of wrapping up the session.
Thanks, Jay. Look, I reiterate what you've said, and thanks everyone for coming along. And I certainly appreciated seeing the chat still going through, and the discussions in the breakout rooms, and the presentation from both Jay's team and Justice Connect. I guess the thing is here, we are trying to do this together and work out and help each other. So I know there's some questions that have come through in the chat that I think are there'll be some answers provided to those. Certainly encourage you to have a look at the resources on the website, encourage you to contact your contract managers, contact us at Partner Support if you need to. But great session, really valued hearing from you myself, and really appreciate the fact that you've taken the time out to join us on a Friday afternoon. So thank you very much, everyone.
Right, thanks everyone, and Michelle has just put there'll be a link to this recording made available on the website as well. So that's the final thing. Thank you for that, Sophie. Have a great afternoon, have a great weekend, everyone, and thanks for taking the time. Cheers.